Just like Dobby. Mom, just like.
Hello, everyone. It's Alicia Hurt here. I am here for another class in our birth series today. Another class. I'm not going to be before you long. And as you can hear, I have little people with me, so bear with me. Here we go. And I can actually hear an echo, so give me a second. I am ready to go now. Okay, no echo. Yay. So this is another class in our birth series, Birth 101. And today we're going to talk about being tiny but mighty. We're going to understand how to manage the impact of premature birth and from conception to adulthood. If your baby is premature, some of the things that may arise with having a preemie. So let's jump right in. So, as I always start off by saying, my name is Alicia Hurt. I am the executive director and founder for I See My Baby. We are advocates for women. We support you from infertility, having a lack of faith, and depression, and everything in between. We are here to help you understand that you do not have to navigate this journey alone. And we have a brick and mortar here in Bainbridge, Georgia, our first wellness center at 310 South Scott Street. We are certified life coaches, doulas, and we have the lived experiences, but we are not medical professionals, meaning we are not doctors. And so we are giving you information, knowledge that is out there already. But if you want to ensure that you are doing what's best for you and for your family, I would say first schedule a one-on-one connection call with us and then help us to become a part of your support team. So that way we can help you in talking to your medical team, your doctor, your OB, your nurses and practitioners. So going back into the topic today, why this topic matters is because every year over 15 million babies are born prematurely around the world, and that's more than 1 in 10 births. In the US alone, the rate remains around 10.5%. And to add to that, 1 in 7 women go through infertility, and then adding to this is if you've gone through infertility, you may or may not have complications, but you may. And so then that adds you into another bracket of this 1 in 10 births for premature babies. So the earlier a baby is born, the higher the risk, but knowledge, prevention, and informed decision makings can shift outcomes for generations. So today we break down the science and the stories, the options, and the sacred journey of supporting tiny lives into strong futures. So we're going to talk about what does it mean to be premature? Why does this happen? What are the impacts, the short term, the long terms, and what can we do to reduce this risk? What choices can families make at birth and after? And how can we support emotional and spiritual healing? And what services exist to support this journey? All right, so late preterm is 34 to 36 weeks. So if you deliver within that time frame, then it's a late preterm delivery. Then there's the moderate preterm, which is the 32 to 34 weeks if you deliver within that period. There's the very premature, which is you are less than 32 weeks. And extremely premature is less than 28 weeks. And babies can survive in all of these, and then babies cannot survive in all of these. It just really depends on what is going on, what is your situation with your baby's health, of, which will determine what the survival rates are, and then when you get the care that you need So global stats, it says 15 million plus premature births happen year-wide, which actually increased slightly from our previous slides. And then the US is again the 1 in 10 births. So here are the top causes for having to go into labor prematurely. And it could be any of the categories that I just broke down. There could be infections, some type of STI or UTI, meaning some type of infection. Maternal conditions, so diabetes, hypertension, preeclampsia, also having cervical deficiencies, maybe something with your placenta, also multiples. If you're having twins or if you're having triplets, you are more likely to give birth earlier than going through full-term labor. If there's any type of stress that you're going through, any type of chronic stress, or if there's any substance use that higher your chances or increases your chances of going into preterm labor, alcohol, drugs, tobacco, all of those things. And so regarding the fetal development milestones by trimester, it'll give you an idea of why it's important to keep that baby in as long as possible. Premature babies, they miss key developmental milestones. So it's breaking it down here. Their lungs develop in the late 2nd and 3rd trimesters. Their brain develops in that last 8 weeks. So it's critical timing. And you may be saying, but they're in there for 9 months. Well, this is the flow of their growth and development. Their gut, being able to suck, swallow, having that coordination, it develops within that 32 to 34 weeks. And their skin has to be fully ready, and it's fully ready 34 to 35 weeks. So if they come before then, that's why you see them in the incubators, and you see that they don't want you touching them a whole lot because of that. Also the immune system, that placenta, it transfers all the different antibodies late 3rd trimester for that baby. So the longer baby stays in, the longer the chances of them having a stronger immune system. Also their visual aid, it shows development timelines from 1 to 40 weeks. And so what you want to take away from this is that each extra week in the womb gives a baby strength, resilience, and stability. So here's some of the short-term impacts of premature birth. So of course you're in the NICU. So you have the respiratory concerns. You have different troubles with maintaining the body temperatures of the baby. They may need tube feeding because they are not able to do that feeding on their own. Because remember on the previous slide, we showed where they have to learn how to do that suck coordination. They may have neurological concerns, some type of hemorrhaging or seizures. They may have immunity issues where they're high risk for infections because they haven't built up that immunity yet. And the impact is not just the baby, but it's also the parents as well, the parents' mental health. I know for me, when I had to leave my baby, my first baby at the hospital, she was in the NICU. It did cause me anxiety. It caused me that depression as well. And maybe some PTSD, because I definitely, after that birth, was like, oh my God, this cannot repeat. This cannot happen again. And then with my 3rd child, she ended up in the NICU, but thank God she was able to come home with us. Also the financial strain, because you had to take off time from work because you don't want to leave your baby there. Your baby needs you. The hospital bills that may be occurred for the baby staying in, depending on if you have insurance or not, the type of insurance. Also, it disrupts your bonding process because essentially when you have that baby's on your chest, you're bonding for the first couple hours. And if your baby has to go directly to the NICU in an incubator, that it just disrupts that normal process. The long-term impacts in adulthood. So they may have one of these 5 things or a combination where there's some type of learning delays in their cognitive. They may have concerns with their attention disorders, ADHD. They may have emotional difficulty with that's difficult for self-regulation. They may have a higher risk of anxiety or depression. Physically, they may be smaller, right? Because of their birth weight and they're coming out, you know, and they're really trying to catch up. They may be asthmatic, or they may have diabetics, they may have diabetes, or even heart disease risk. And then socially, sometimes they are delayed from, you know, another 5-year-old, and they're like, oh, well, she was a preemie or he was a preemie, because sometimes they're a little delayed and need extra help and support. I know for my daughter, we had to have her tested to make sure her birthing experience didn't hinder her from being able to socialize and hit those milestones. And thank God she was able to, but some kids cannot. They're a little delayed based on being preemies. So you want to follow, one case study we followed was a child that was born at 28 weeks through school, adolescence, and young adulthood. And it really showed how multiple parts of what we just discussed, it affected that baby, and how they had to have different supports in place, both to help with their cognitive, their emotional, their physical, and their social, to keep them moving along. The risk factors and what you can control. These are things that you say, okay, well, sometimes it's out of my control. Well, we're going to talk to you about some things that you could control. You could try your best to. So here's some that are non-modifiable. So prior preterm birth, so you can't modify that. If you had any issues with your womb health, any abnormalities, or if you have multiple babies, you can't help that. That's something you cannot help, you cannot control, because it's highly unlikely they will not allow you to go the straight 40 weeks with the multiples. You just can't control that. You can't control your anatomy. How you were born is how you were born. And then what happened previously, you can't control that. But what you can control, what you can modify, is smoking, alcohol use, or drug use. Also, treating infections properly. So if you have an infection, treat it before the baby gets here. Talk to your doctor, stay up with your appointments. That can help. Manage any type of chronic stress that you have. Get on a regimen. Talk to your psychiatrist or your psychologist. Also, having a healthy diet and prenatal care, that will support you as well. And some actionable tips would be to have your regular checkups, monitor your cervix length. Your doctor will do that part. Also, talk about your progesterone therapy, if it's at risk or not. Your doctor will tell you, because they'll take a whole lot of blood from you and periodically throughout your pregnancy to keep up with it, but you have to stay on top of it as well. And also faith-based motivation, because you got to understand you're not alone, you're not powerless, and God works through your choices, and he helps you. He helps you with your discipline as well. And that is referenced in James 2:17. And this is one of our babies at the top here that was born recently. Our mom is there supporting her through that final stages of labor. I love this picture so much. It speaks volumes to having a great support system. But holistic and healthy and lifestyle-based prevention methods. So one, taking your supplements, right? Your omega-3s for your brain, inflammation, it helps. Your iron, right? Your folate, your calcium, and being hydrated. I speak to everybody about Infuse here locally in Bainbridge, but they have all type of hydration IV places in every state, where you can say, I don't like to drink a lot of water. Well, you can do some hydration to help you. Make sure you talk to your doctor beforehand. Or just go to the doctors. I remember just going to my doctor, say I'm dehydrated, and they'll just give you fluids right then and there. Also, your physical care. You want to make sure that your physical care is on point. Having safe prenatal movement, walking, stretching, and swimming, and your stress reduction. Okay, so for your doula and your therapist support, you want to pray, you want to journal, you want to do your breathing exercises, and have group support. And again, that spiritual aspect, I'm going to always talk about it. You want to make sure your mental and your spiritual is alignment, and that you're at peace, because that impacts your physical outcomes, and you need to honor both. We are wrapping up here. We're wrapping up. I am running into another meeting, but you want to partner with your community to support and to reduce your risk of going into preterm labor. You want to partner with your emotional stability to help. You want to be able to stay calm. You want to know your triggers. You want to be able to say, like my husband and I, we had a word that we use. So if you have a word that you use, or even a look during that birthing process, or as you're going through your trimester, say you have an open dialogue. Hey, I need you. I need support, right? Even going to a doctor's appointment because he may have heard something that I did not hear, and then we can compare notes. Also getting that self-care in, even if that just means you sitting on the porch drinking your tea. If that's your self-care, that's your self-care. Also having a doula or midwife, that's where we come in to support and to help you. Please reach out to us, your local health department, or any type of nutrition coaches with the WIC. That definitely helped a lot with all of my babies. It really helped with the financial strains that come with having to buy the milk, buy the Pampers, and then eat more healthier while you're pregnant. And then prep programs like we have the preterm workshops, the faith center coaching that we support you with here, doula-led pregnancy care, and also the yoni steaming. And that is to help you have a baby. Once you're pregnant, you do not yoni steam, but then after the baby, when you're cleared from your 6 weeks from your doctor, then we put you back on a yoni steaming regimen for womb health. So again, here are some options for you. You definitely want to talk to your doctor, confer with your OB on these various interventions to help you to make sure that your baby is not born prematurely. And just to hit it a little bit, we had a previous course about the delayed cord clamping, but just to talk about it, it's a big benefit in it, and it does not disrupt anything. As long as you're not having an emergency C-section or anything that's just out of the control of a normal birth, you can request delayed cord clamping. And here are just some of the benefits highlighted on the presentation, where the baby gets more blood volume, they get better iron stores, and it reduces transfusions needed in the future. And it also helps with the preemies because they have less brain bleeding and improved stability. My son is not giving up, y'all. We're almost done. It helps with your spiritual and emotional healing after preterm birth, helps you with any guilt, grief, or anxiety that you may feel. And it also helps if you start to embrace counseling if you're not in it already, journaling, and we have a plethora of resources. So just send us a message, email us, and we can refer you to some of our journals to support you. And then we have group therapy here. We have a group therapy session every Friday from 3 to 4 o'clock at the Wellness Center. And we do have prayer and support groups as well. And the scriptures to go along with that is here documented for you. I want to just thank you all for listening today, hearing me today. I know that we went through this fast. However, I'm always a phone call, an email away, a DM away to really dive in deep, depending on your circumstance and situation, and putting together a customized program for you. I want to thank you for your listening ear. And I want you to really understand that premature birth is not the end of a story. It's the beginning of a new chapter that calls for compassion, courage, and community. And we've explored how early birth affects every part of development and how prevention can be achieved through holistic and clinical care, and how powerful informed decisions are around birth and postpartum healing. So thank you all for your listening ear. Again, my name is Alicia Hurt. I am the executive director here at I See My Baby Women's Wellness Center at 310 South Scott Street. And I look forward to seeing you, hearing from you, and helping you on your journey.